I think it was a very exciting year for acute myeloid leukemia, albeit some of the folks that joined the meeting, including myself, joined virtually, so not in person. I hope that in the coming years that will change. So let's start with newly diagnosed AML. So newly diagnosed AML, I think there were some interesting findings. There were some phase 3 data that were presented. One was the AGILE that compared hypomethylating therapy with the IDH1 inhibitor ivosidenib versus hypomethylating therapy plus placebo. That was a positive study with improved event-free survival for the HMA plus ivosidenib arm, as well as improved overall survival and improved rates of remission. So overall, a very impressive phase 3 positive study that was presented by our colleagues. Intriguingly, the overall survival duration was quite impressive as well, at around 24 months, which is about as long as you will see in that older patient population that received the combination. There was also the presentation of the Lacewing study, which was the comparison of hypomethylating therapy again, but this time with the FLT3 inhibitor gilteritinib versus hypomethylating therapy azacitidine alone. Initially, there was another arm that included just the FLT3 inhibitor alone, but that was closed. So that study, unfortunately, was negative. There was no overall survival advantage. The rates of response and remission were higher for patients who received the combination, but that was not ultimately the item of interest. The overall survival was not increased for the combination. There was some suggestion, perhaps, albeit sort of subset analysis, suggesting that individuals that had a high allelic burden of FLT3 mutation did better with the combination as opposed to just azacitidine alone. But that, again, is just subset analysis. So let me move on now to relapse refractory AML. This is also an area of interest. Dr. Stein from Memorial Sloan Kettering, a good colleague of mine, also presented data on the menin inhibitor from Syndax Pharmaceuticals, which revealed impressive rates of composite remission in patients who had MLL rearrangements or NPM1 mutations. That data is early, and there are other companies that are also developing menin inhibitors. We shall see ultimately where the promise of this class of drug is. Another good friend and colleague of mine presented data on a interesting FLT3 inhibitor, HM43239. This novel FLT3 inhibitor seems to have activity in patients who are multiply relapsed with FLT3 mutated disease. So there was some interesting data that was presented at this year's ASH meeting for newly diagnosed and relapsed refractory AML. Finally, I just want to mention that there was also some data on maintenance. Specifically, there was an update on the QUAZAR data that compared oral azacitidine versus placebo. Ultimately was a positive study presented and published recently, but this was longer-term data updated at this year's ASH meeting, which again showed promising overall survival advantage going out beyond 3 years. But that's my summary of some of the findings I found interesting at this year's ASH.